Welcome back to Open School. In the last session, we have discussed about an introduction to the compensation that occurs in ABG. And today we'll be discussing the compensatory rules or the rules for compensation in respiratory disorders. And Dr. Andrews, Professor of Medicine, consultant neurologist. So we have now understood that the respiratory disorders, when the pH is decreased, it is respiratory, and the PCO2 is increased in respiratory acidosis, easily remembered by the mnemonic ROM. Respiratory opposite. That is the change in pH. When the pH decreases, PCO2 increases, and vice versa. When the pH increases, the carbon dioxide comes down. For the metabolic, when the pH is decreasing, the bicarbonate is decreasing. When the pH is increasing, as in metabolic alkalosis, the bicarbonate increase. So this is the mnemonic ROM, respiratory, opposite, metabolic, same. So keep this in mind when you are looking at the ABG, looking at the pH and identifying the primary disorder. Now we look into the rules of compensation in acid-base disorders. Today's topic is respiratory acid-base disorders. What is the rule? I have discussed about the mechanism of compensation and why there is compensation and what is compensation previously. Now the rule is 1, 2, 3, 4, 5 rule. In acute respiratory acidosis, for example, somebody is hypoventilating, that is respiratory rate is decreased. So what will happen? The PaCO₂ will increase because of the hypoventilation. Carbon dioxide is a function of the ventilatory function. So the PaCO₂ increases. When the PaCO₂ increases, what happens is the carbon dioxide will combine with water to form carbonic acid, which is an acid which dissociates into hydrogen ion and bicarbonate. So this is the basic physiology that you will be keeping in mind. So here we are expecting a change in the bicarbonate. What is the change you are expecting? When the PaCO₂ increases, we have to make the bicarbonate also increased. That is what is called the expected change in the bicarbonate, or what is the expected value. So what is the expected value? You can easily remember by using this rule. For acute respiratory acidosis, each change of 10 millimeters of mercury PaCO₂ change, that is change of 10 millimeter, when it is increasing, this will produce an increase of bicarbonate by 1 milliequivalent. So very simple to remember. Hope that is clear to you. That is, in acute respiratory acidosis, the PaCO₂ increases. Every 10 millimeter mercury rise of PaCO₂ will produce a increase in bicarbonate by 1 milliequivalent. That is the rule of 1. So if you take the chronic respiratory acidosis, just see that it is 4. That is what is called the rule of 1, 2, 3, 4 and 5. So here it will be 1 and 4. So hope this you have understood this point. That is, in acute respiratory acidosis, the increase will be 1, and in chronic respiratory acidosis, each increase of 10 millimeters of PaCO₂ rise will produce a rise of bicarbonate by 4. Now they take the acute respiratory alkalosis. In respiratory alkalosis, what will happen? For example, somebody has got an anxiety, patient is hyperventilating. So when the patient is hyperventilating, what happens? The carbon dioxide is washed out. So the PaCO₂ comes down. So in a respiratory alkalosis, the PaCO₂ comes down. So when the PaCO₂ comes down, what will happen to the, we'll go to the equation, carbon dioxide plus water produces H2CO3. H2CO3 dissociates into hydrogen ions and bicarbonate. What will happen here? When the carbon dioxide is less, there is a less amount of hydrogen ions. So what should happen? The bicarbonate should also expected that the bicarbonate will come down. That is a compensation. So in acute respiratory alkalosis, each 10 millimeter mercury fall of PaCO₂ will produce a reduction in bicarbonate by 2 milliequivalents. So that is a rule of 2. So in acute, it is acute respiratory alkalosis, the reduction in bicarbonate is 2 per 10 millimeter mercury fall of PaCO₂. If it's a chronic one, it increases to 5. That is a rule of 5. So now you have understood the rules. Acute respiratory acidosis. Rise in PaCO₂ per 10 millimeter mercury, increase of PaCO₂ will be 1 milliequivalent of bicarbonate. If it's a chronic one, it becomes 4. In respiratory alkalosis, what happens is 10 millimeter mercury fall of PaCO₂ will produce a reduction in bicarbonate by 2 milliequivalents. And if it's chronic one, it becomes 5. So it becomes very simple. That is called the. But again, remember, this is only a bedside approximation. It's not the exact value, but for all practical purposes, this will serve. So write down this formula and keep this in mind. So today I have discussed about the rules of compensation for respiratory disorders, acute respiratory and chronic respiratory acidosis and alkalosis. Stay tuned for further videos. Thank you.